Welcome to this introduction on how machine learning is changing the drug discovery process. Why should we care? I think that everyone should care about machine learning because all of giant companies like Facebook, Google, Amazon are using machine learning widely to recognize faces, to teach cars how to drive, to set prices, to maximize gains. And it won't be long until governments start using it too widely. So I think we all should be able to discuss the ethics and the politics associated with this form of artificial intelligence. What scientists and doctors are also using it with amazing success. Just pause the video and take a look at these papers. These are all from Google Scholar, so you can look it up in the web if you go right now. You see here deep learning. I've already talked about artificial intelligence. This presentation is about machine learning. And what is the interplay between all these concepts? Well, machine learning is a form of artificial intelligence, and deep learning is a form of machine learning. So every time you see deep learning, you could say that you're talking about machine learning, but not the same happens with artificial intelligence. DAPHNE KOLLER talks about this in one of her interviews. I'll leave the links below. Well, in this 21st century, we have seen amazing and tremendous advance in medical treatment. However, we are hitting a dangerous plateau in drug R&D efficacy. Like decades ago, you had dozens of drugs per 1 billion spent in research, but right now you have to spend $2.5 billion and wait a lot of years to have an approved FDA drug. Success rates is around 5%, and this waste of resources is caused by our inability to answer all of these questions. Again, take a look at these questions. These are key questions in the efficacy of a drug, and we are failing when answering these questions. We are failing a lot because maybe we don't understand biology as much as we thought. So here, machine learning can help. Machine learning can help a lot here because machine learning is a really good predictor. But you might be asking, what is exactly machine learning? So in the old days, machines didn't need to learn because they were already programmed. But we are hitting a moment in which the tasks we want to assign to machines are tasks that are not easily explainable. Like you can't explain how to recognize a face. It's just in your brain. It's really difficult to explain how to drive a car. It's also really difficult to actually do drug discovery. So how could you explain it if you can't even do it with efficacy? So let's see how could we answer this question. Like, will be a drug hepatotoxic? Hepatotoxic is just the fancy word for toxic in the liver. And when programming your software, you'll have three main components that we'll call teacherbot, predictorbot, and tweakingbot. Teacherbot isn't actually a teacher. It only shows data to predictorbot and to tweakingbot, and then tests predictorbot. I mean, some teachers only show data and test, but not all of them. And predictorbot is constantly shown data with the right answer associated with it. Like it is shown this molecule, and it is told that it's hepatotoxic or not. And then tweakingbot makes like adjustments, tunes the wiring in predictorbot brain. So every dial here, every dial of that tweakingbot can modulate is associated with the strength of a single connection. Here you can see also the connection. And an example of this would be fluor and hepatotoxicity. This is simple. Every time a machine with fluor is given to predictorbot, you can see that it is hepatotoxic. So the next time a molecule is shown to predictorbot without the explicit answer, if it has fluor, it will tell that it is hepatotoxic, because by showing it fluor molecules that are hepatotoxic, the connection between fluor and hepatotoxic has increased in strength. I think we all get this. And if you do this repeated amount of times with enough variety of molecules, you'll end up having a really complex wiring in predictorbot's head. And it can consider many inputs, and it can recognize many patterns, and it will end up having a really good criteria, a really low error when determining if a molecule is hepatotoxic or not. And when the test comes, when the test of teacherbot comes, predictorbot sorts molecules into hepatotoxic or not hepatotoxics, and these are molecules that it has never seen. And it can do so well because of this complex wiring and because of the big amount of data that supposed so much tweaking and so much tuning and so much figuring out what is important or what is not important when in a molecule when you want to say if it is hepatotoxic or not. So it can figure out patterns that are easy to recognize even by humans, like fluor and benzene equals hepatotoxic. We have already seen this. You could do this perhaps, and it's kind of boring. I know, it's like, boring. However, we have enough tweaking, enough leads to tweak, and enough wide data and big tests, it will end up telling if any molecule, any small molecule, is hepatotoxic or not. And this is not boring, this is astounding. And this phrase is bold, but this phrase is true. With large enough data sets, computers can predict better than humans. That's why we are so obsessed with big data, because big data means big tests, means better predictions. And we are not talking about easy predictions, we're talking about predictions that are out of reach for even humans. So these algorithms obviously are being widely applied in drug discovery, are being widely applied in medicine, and will keep growing. The use of these algorithms will keep growing, and this will be a great field to be part of in the following years. Well, many thanks for watching, and don't doubt to reach me if you have any amendment to what I've said or just want to discuss machine learning. Many thanks. See you.